Prime Minister and other those who are involved in this. So I will not take much time. We have already started this. So I hope at the end of this e-workshop, you will be able to know the basic concept of this statistical method, techniques. With these words, once again, I welcome you to this workshop on the statistical technique for research study tool design, and hope that you'll enjoy this special moment of the academic phase. Thank you very much. Thank you.
Thank you, sir, for the kind words. Your words have been always an inspiration for us. I would now like Dr. Abhishek De, who is the mentor of this workshop, to say a few words about his experience, and then we shall start.
Thank you, Dr. Rivu, and welcome everybody. Welcome Sanjay sir, welcome Shumana ma'am to this workshop. And this has been an idea of mine and Rivu's for the last 1.5 years. We've been planning it on and off. It was first in physical mode, but then the coronavirus came and changed it to a virtual workshop. And I feel that it's a very relevant and a neglected topic in our curriculum. And I feel that all the participants who are from varied backgrounds and from all over India, we have, I think, one from Saudi Arabia as well, who is an IPHA member. So this actually makes it an international e-workshop. So we would all benefit from the excellent materials, and hopefully the next 5 days would be a really interactive and wonderful learning experience for all of us. Thank you.
Thank you, Abhishek Da. That was a very modest introductory speech. I would now ask Shumona to start her session without wasting much more time. Shumona, if you are ready, please.
Yes, thank you so much. It's okay. Good evening, all of you, and it's really a pleasure to be here to meet you all, sir. There are a few things which I would like to mention before I, go into the details of this workshop or start today's session. The first thing is that I strongly believe in the dissemination of knowledge. So whatever I will be speaking about in the next, today included in the next 5 days. So I will try to disseminate as much of knowledge that I have gathered across all these different years of my research. I am now in the field of research for, like 9 years. It's almost. So I'll try to give my level best so that you can benefit from whatever knowledge I possess about this particular subject matter. And my request is, since you are from a different background, it might appear to you at some point, it might appear that, it's not making sense, because I am from psychology background, and I'll be talking about certain issues, certain constructs which are psychological in nature. So if that is true, please do not hesitate to stop me and ask me, like, I have not understood this part, so kindly explain. I'll be more than happy to explain it over and over again until you be satisfied, all of you. And I hope that all the different materials which I have sent, thanks to Dr. Abhishek De and thanks to Dr. Rivu, they have done an excellent job to communicate with you all and share it with you all. So I hope it's there with you. So in the these 5 days, I will be talking about different topics in each of these days. So today I'll start with a general introduction to psychometry, and tomorrow we will be discussing on item analysis. Day after tomorrow we will be discussing on reliability and validity estimation. Then on the 4th day we will be discussing on the test standardization techniques, and in the last day we will be discussing on the modern approaches to psychometric test construction along with demonstration. So I think it is just today that we are not going to have any demonstration, so relax. From tomorrow onwards, we are going to have demonstrations. So I'll request you all to be ready with the Excel, SPSS, and RStudio. At the end of today's session, I'll try to demonstrate a little in RStudio, because I was seeing that you have a lot of you have lots of concerns regarding RStudio. So I'll brief a little on that. So yes, that's it. So if you permit, then I'll straight away go into the PPT slides.
Okay, sir, we are starting then. Sanjay sir, we are starting then with your permission. Okay, we can start. Okay. Yes.
Okay. Thank you. Okay, is this visible to you all?
Yes,
Yes,
this is
it is.
visible. Please,
Okay.
can you go to the full mode?
Yes, I have done it. Okay, can you see the full screen?
Yes, we can see the full screen.
Okay, thank you. Okay, so today's lecture is on basic principles of psychometric tool construction, and these will be the things that we will be discussing in today's session. So, introduction to psychometric tool construction, defining a construct, types of psychometric tools, fundamentals of measurement, then response types, binary and polytomous, and finally items, definition, type, and construction. Okay, so I have given here some research problems. Okay, and as you can see, the first is like, is having diabetes related to depression and quality of life among young adults? Second one is, what is the degree of subjective well-being among individuals suffering from anxiety and hypertension? Third is, what is the prevalence of mental disability in the Indian population? Fourth is chronic symptoms of IBS related to psychiatric morbidity and health-related quality of life? And fifth is iodine deficiency related to the intellectual functioning of Indian children? Now, if you can see all these different research problems, I have highlighted a number of constructs which are pertinent to not only to psychology, but I believe also to public health. So, for example, like depression, quality of life, subjective well-being, anxiety, mental disability, psychiatric morbidity, health-related quality of life, intellectual functioning. So the first question comes is how to measure these different constructs that we have. Okay, and before going into the measurement of these constructs, before that comes the other question, which is, what is a psychological construct? Right. So a psychological construct here can be defined in several different ways. It is an idea or perception resulting from a synthesis of sense impressions. So constructs are self-defined, right? Construct must be sufficient enough to define any particular phenomena that we want to consider for a testing. A psychological construct is defined in the terms of operations necessary to measure it, and the measurements are defined to be measures of the psychological construct. So there you can find two very important points. One is operations necessary to measure it, okay, and these measurements, okay, whatever you are measuring, they are defined to be the measures of the psychological construct. So there are two different aspects of a psychological construct. One is the conceptual part, other is the operational part. The conceptual part tells you about how you are defining a particular construct, and the operational part tells you how you are measuring what you have defined, right? So there is something called a construct cleanliness. What is this construct cleanliness? A construct is clean if it evaluates what it is supposed to evaluate. If there is no discrepancy between the construct and the measured variable, then it is clean. For example, suppose I am defining depression, right? Or maybe take, for example, quality of life. Okay, so how am I defining quality of life and how I am actually measuring it? There comes the concept of this construct cleanliness. If whatever I have defined and whatever I am measuring, they are similar to each other, they are actually fitting with each other, then the construct is clean. If it is not, then there is a problem. Okay, a construct can be problematic in two ways. The first is deficiency. What is this deficiency? If the variable is not able to cover the entire domain of interest, then it is called deficiency. The other part is called the contamination. If the variable contains information that is not part of it, that should not be part of it, okay, that becomes the contamination. So if your construct is having these two different problems, one is deficiency, one is contamination, then whatever you are measuring, that will not give you a very good picture of how you have conceptualized a particular phenomena. For example, quality of life. Now, there is a health related quality of life which is more pertinent to your field of public health, and there is a construct called quality of life which is more pertinent to my field of psychology, right? Now, what is the difference between these two different constructs? Both are quality of life, both are trying to define quality of life, but how is it differing? Right now, the most differentiating factor in this case is the health part. Okay, but if someone is not healthy, can you say that the person's quality of life will be better, like it will be good? Well, that's a question. So this is how you have to be extremely precise in defining a construct before measuring it, because it is related to the reliability and validity of what you are measuring. Okay. So defining the construct, there are two different parts of it, as I said. The first is the conceptual definition, which is meaning of the construct and how it is related to other constructs. And the other one is operational definition, which describes the variable that is an indicator of the construct and the procedure to measure it. So a construct is different from a variable. We measure the variable. We do not measure the construct as a whole. Okay, we measure the variable. This variable is basically a representation of the construct. So, for example, this health-related quality of life, the conceptual definition is, it is defined as the patient's general subjective perception of the effect of illness and the intervention on physical, psychological, and social aspects of daily life. That is the conceptual definition. Operational definition is, it is defined as the perceived quality of life as measured through the scores obtained in the health-related quality of life questionnaire for a specific illness. So you better know this. So there are health-related quality of life questionnaire for for those who are having problems with their teeth, for those who are having cancer. Okay, so it can be extremely varied, right? So that becomes the operational definition, how you are measuring it. So at any point of time, when we are doing this, when we are trying to develop a particular measure, this is the first step that we need to follow. We need to define a construct conceptually as well as operationally, because this operational definition will give me a clear idea about how I am measuring this particular construct and what can I expect from the scores that I am obtaining. Okay. So what is psychometry? Psychometry is the subfield of psychology that is concerned with the theories and techniques of psychological assessment. Now you can see here I have given kind of a hierarchy. So assessment, then measurement, then psychometric testing. What does it mean? So basically assessment is a much bigger term. It is like a umbrella term, okay, within which lies the measurement, which in turn includes psychometric testing. So any kind of anything that you are measuring, okay, measurement means assigning some numeric values to a particular phenomena, right? But there are instances where we do not assign some numerical value, isn't it? Numerical value to a behavior. We simply observe it, okay, and try to assess. That's why this assessment part includes all these things, both quantitative measurement as well as qualitative part. Observation, okay, it can be interview. So you can interview a person and you can get some input, and from that particular input you can come to a particular conclusion. Okay, it's a subject of the qualitative research. But when we are assigning some numbers, that becomes quantification, and that is the measurement part. And also when we are assigning certain numbers, it becomes measurement, yes, but all kinds of measurement are not psychometric testing. It can be several other kinds of measurement as well, right? For example, you can use a particular a machine to assess something. Okay, you can use a stress thermometer to assess whether the person is stressed or not. You can use the EEG machine to assess the intellectual functioning, the brain functioning of the person, whether there is any kind of organic problem. Okay, and you can also use psychometric testing. You can also do psychometric testing to assess the same, right? So that's why psychometric testing comes within measurement part. Okay. So what is the need for psychometric testing? First of all, to provide a very objective measure of subjective behavior. Okay. And subjective behavior is anything and everything which we can see, which is observable, right? So behavior we can observe, we can see, but at the same time behavior is extremely subjective, right? So when a patient is coming to you, you are observing several things. How can you frame it? How can you make a diagnosis? Because all these different patients, they have their own individual differences. They have different manifestations, right? So that's why psychometric testing, in a similar fashion, it is an objective measure. It puts all these different individual differences in one particular framework and helps us understand, where the problem lies. Second, to assess individual differences, as I said. Okay, sometimes we, for example, in psychology, we measure the personality. Okay, so which particular person is having a kind of extrovert personality, which particular person is introvert by nature, who is neurotic in nature. So these are the several different kinds of individual differences that you can see. And for assessing these individual differences also, we can do psychometric testing. Third important point is generalization from the behavior sample. Okay, whatever we are testing, that is not limited to the test situation, but also to other non-test situation like the real world. Okay, so if I'm testing the anxiety of a person, okay, and I find that the person's maybe state anxiety and trait anxiety both are quite high, so I can make a generalization that the person will be usually nervous in other different situations of life as well. Okay, so that is another important need for psychometric testing. Then to make a diagnosis or screening, that is also another very important aspect of psychometric testing for doing any kind of diagnosis, specifically psychiatric diagnosis. And for screening, you can think of like, all the different examinations, competitive examinations that people appear for. So the basic purpose of all this competitive examination is to screen out, right? So any kind of screening requires testing. Okay, then to make prediction based on, as in, if the person is exhibiting this kind of a behavior, what can happen in future, right? And let me just give you an example. It was found that patients who are suffering from schizophrenia, they if someone is having lot of self-confidence, we call it self-efficacy. If a patient who is suffering from schizophrenia is self-efficacious, then the patient's prognosis has been found to be much better, right? So that is the kind of prediction that is happening in this case. And then for classification, so if I want to classify people based on a particular phenomena, okay, those who are who have a better subjective well-being, okay, those who are they are happier than others. So these are the kind of classifications I can do based on the psychometric testing, right? So types of psychometric tools. Now, these are the two very specific kind of psychometric tools that we can use. One is ability testing, another is a questionnaire or rating scale. And this ability testing, this includes another 3 different types: verbal test, non-verbal test, and performance test. Okay. So let me just straight away go into the different kinds of psychometric testing and their description. So for a verbal test, items emphasize on reading, writing, and oral expression as primary mode of response. Example can be Army Alpha test, Mehta group test of intelligence, like that. Non-verbal test, language is mainly used for giving instructions. Items are presented in symbolic forms like pictures, figures, etc. Example can be the Raven's progressive matrices. That is one kind of test for assessing intelligence. I'll show you examples of these sample items of this particular test. Then performance test, no use of language in expressing response. Items include assembling puzzles, replicating pictures, etc. Examples can be Alexander pass-along test, Coase block design test. Both of these are tests of intelligence, but also sometimes used in the clinics for assessing if there is any kind of organic brain deficiency. Okay, and finally questionnaires. So items are presented in form of statements about a specific issue, and respondents are instructed to indicate their response on a graphic or numerical dimension representing the person's degree of agreement, experience, or attitude. Now, I think that most of you are acquainted with this kind of testing questionnaires, and this can include like self-efficacy scales, attitude scales, quality of life questionnaire, etc., etc. Okay. So before going into the different kinds of scales and tests that we have, I would like to discuss a little about the fundamentals of measurement. Okay, because it will help you to understand how we can classify the responses that we get in a particular test or a questionnaire. So there are three very basic postulates of measurement. The first one is postulate relating to equalities or identities, such that either A is equal to B or A not equal to B. So you can think of like, whether one particular object or a phenomena is equal to another one or not. Okay, that is the postulate relating to equalities or identities. The second postulate relates to rank order, such that A is greater than B, B is greater than C, and so on. So, for example, in a class, someone secures the first position, someone secures the second position, and so on. So, the person who secured the first position definitely scored higher than the one who secured the second position, and so on. So, there is either a increment or a decrement, and that tells you about ordering. Okay. And the third postulate, it relates to additivity. Additivity such that A plus B is equal to B plus A. Okay, and it means that additivity, it means that, when you are adding 2 plus 3 is equal to 5. You can also think of it like 3 plus 2 is equal to 5. And additivity is such a postulate which is related to all the different very basic mathematical relations that we can think of, like subtraction, multiplication, division, etc., etc. Okay, so based upon these postulates, these 4 different levels of measurement are defined: nominal, ordinal, interval, and ratio scale. Okay. Now, what are the different scales of measurement that we have? Nominal scale, it is the lowest level of measurement that only serves the purpose of naming, identity, or classify persons, objects, or groups. For example, male, female, married, unmarried, Hindu, Muslim, Sikh, Christian, etc., etc. So you can see that, in this case, it serves only the purpose of identification, in that male, female, you can identify a male or a female, but you can neither say that a male is better than female or a female is better than male, or you can add male plus female is equal to something, or male minus female is equal to something. These are all meaningless relationship, right? So here we are simply identifying or classifying people, right? So that is the nominal scale, and it is the lowest level of measurement. The next higher level is the ordinal scale, which incorporates the property of magnitude, but not of equal interval or absolute zero. I will be explaining these 3 different properties in a while. So anyway, ordinal scale basically, it is applicable in such cases where the relationships are expressed only in terms of greater than or lesser than, like that. Okay, so I can say, like, if we consider, for example, the socioeconomic status, okay, there are people who belong to the BPL, okay, there are people who belong to the lower middle class, someone belonging to the middle class, someone belonging to the upper middle class, and then the upper class, so on, right? But here also you can see there is either you can order people in the ascending order or in the descending order, but you cannot assume that the difference between these different classes I'm saying are equal. It is not like the distance between below poverty line category and lower middle class category is the same as the distance between middle class category and upper middle class category. That is meaningless. Okay, so that's why that is the ordinal scale, which specifically stresses on the greater than or lesser than relationship. Next comes interval scale. Now, this is of particular interest to us because any psychological attribute or any attribute which relates to the human behavior can be measured only in the interval scale, right? Interval scale or sometimes in the ordinal scale, as is true in case of rating scale. I will be explaining that in a while. But interval scale is the third level of measurement, which includes all the properties of nominal and ordinal scale. But in addition, numerically equal distances on the scale also indicate equal distances in the properties of the objects being measured. But there is no absolute zero property for interval scale. Rather, it assumes arbitrary zero. Okay. Now, let me just explain this part using some examples. For example, temperature. Okay. Temperature, although it is a physical measure, it comes under the interval scale. Why? Because temperature, in case of temperature, there is no concept of absolute zero. Now, what is this absolute zero property? Absolute zero property means a complete absence of a particular phenomena that is being measured. Now, you can think of it like that. If we are saying 0 degrees Celsius, it does not mean that there is no temperature. There can never be, absence of temperature per se. Whether you stay inside Earth or you go beyond Earth into the space, right? So, always it is either hot or it is cold. And even 0 degree temperature also implies that there is some temperature. Okay, so in any kind of such scale where there is an absence of this absolute zero, we call it the interval scale. The same applies for any kind of psychological attribute. For example, intelligence scores, psychiatric morbidity score, quality of life score, etc., etc. Why? Because when I'm saying somebody's intelligence is 0, can I say that? Well, no. The answer is no. Why? Because when we are trying to assess the intelligence of a person, okay, the minimum that can be reached is the profound mental retardation, and that also below the score of 20, in some cases 25. Okay, we call it the profound mental retardation category. But still we cannot say that the IQ of a person is 0. Why? Because the fact that the person is living and breathing is evidence enough that the person's IQ, the brain's intellectual functioning, cannot be absolutely 0. Okay, even if you consider some other kind of variable like say depression, there also the same thing applies. If I say that a person's score, the person has no depression, that becomes quite meaningless. Okay, why? Because depression is basically defined in a very relative term. Okay, and these highs and lows in the mood, that can always happen. Okay, and that's why we can never say that a person has no depression. So even if I give a score of 0, that does not mean that the person has no depression. Okay, so that's why all these different scales, all these different attributes come under the domain of interval scale. Okay. Also, there is another important aspect in this case, in case of interval scale, because there is no assumption of absolute 0, we cannot break down any of this in decimals. We cannot say that the IQ of a person is 91.5. Okay, we can do it in case of temperature, but we cannot do it for the different psychological attributes that we have. Okay, and then the highest level of measurement, that is the ratio scale, which includes all the properties of nominal, ordinal, and interval scale, plus an absolute or true 0 point. So you can think of any physical measure, in this case, weight, height, length, etc., etc., and all these different measurement scales have an absolute 0, which means that when I'm saying the weight is 0, it means that there is a complete absence of weight. The object is weightless. Okay, that is physically possible. So based on these 4 different scales of measurement, okay, we can classify how the responses in a particular test or a questionnaire differ. Okay. So these are the 3 different properties I was speaking about: magnitude, equal intervals, and absolute 0. Magnitude is a property of moreness. So a particular instance of the attribute represents more, less, or equal amount of the given quantity than does another instance. For example, A is taller than B. That is a property of magnitude. Okay. Equal interval is what? Difference between any 2 points at any place on the scale has the same meaning as the difference between 2 other points. For example, difference between 5 centimeter and 8 centimeter is the same as the difference between 20 centimeter and 23 centimeter. Okay. And finally, as I explained, absolute 0 exists when nothing of the property being measured exists. Okay, for example, quantity of a drug in the blood can be 0, meaning complete absence of that particular drug. Okay, so if we can classify based on these 3 properties, nominal scale does not have the property of magnitude or equal interval or absolute 0. Ordinal scale has the property of magnitude because it talks about the moreness, greater than, lesser than relationship, but not equal interval or absolute 0. Interval scale has the property of magnitude, equal intervals, but no absolute 0. And ratio scale has all the properties of magnitude, equal interval, and absolute 0. Okay. So based on this classification, this understanding, these variables can be classified in 2 different categories. Okay. So anything that comes to you in the form of nominal scale or ordinal scale are therefore taken as discrete variable, categorical variable. Okay. And anything that comes in the form of interval scale and ratio scale are considered to be continuous variable. Okay. Right. So discrete variable and continuous variable. Now, there is one thing that I would like to mention in this case. Interval scale is also considered to be continuous variable, although I mentioned that there is no concept of absolute 0. But for all practical purposes, we consider measure or scores in interval scale to be continuous in nature. Okay. And all the different statistical techniques that are known to us, like central tendency, the dispersion, okay, measures of dispersion, then correlation, regression, t-test, ANOVA, all the multivariate statistics, everything is applied for this interval scale because we consider it to be the continuous variable. Okay. So it is just for the practical purpose. And there is just one specific statistical technique which cannot be applied for interval scale. If your scores are in interval scale, that is the coefficient of variation, because coefficient of variation is a ratio of the standard deviation and the mean, And since mean is easily affected by other scores and it can move, so if we calculate coefficient of variation based on scores in interval scale, that can lead to erroneous results. But other than that, we do not usually use coefficient of variation so much. So that is not a problem. So for all practical purposes, we classify nominal variables and ordinal variables as discrete variables or categorical variable, and interval variables and scores in interval scale or in ratio scale as continuous variable. Now let me give you some examples. So I hope you can see there are these different kinds of questionnaires and tests that are given here. This is okay. Is my cursor visible to you all? Can you see my cursor? I'm moving my cursor. Can you see that?
Yes, it is visible.
Okay. Okay. Thank you. Thank you. Okay. So this is an example of a test sample. Okay. As I was saying, Raven's progressive matrices. It is it's a sample item of Raven's progressive matrices, which is a sample of, which is a test of intelligence. Okay. This is a particular questionnaire that you can see, and it is basically the anxiety questionnaire. Okay, STAI, state trait anxiety inventory, and this one at the left lower end is the scale of Kusumi, which measures the socioeconomic status, and this one on the right lower end measures, it's basically an information schedule. And in any research, when we are collecting data, we need to have an information schedule because it tells us information, it gives us information about the subjects, right? So now all these different kinds of tests or questionnaires, they give us different kind of responses, right? So let's see. Broadly, these responses can be categorized into binary or dichotomous response, and the other one as polytomous response. Okay, and let's see how. So I've just come back to the slide again, and can you tell me where can I get a dichotomous response and where can I get a polytomous response? Anyone?
Six
Scale.
maybe dichotomous. Yes.
Yes.
Anxiety scale, here all the responses will be polytomous. While in belonging to a particular category, it is yes or no. So it can be either yes or no.
Yes. So that is also dichotomous. And in this case,
gender, it's also dichotomous.
Yes,
Gender.
yes, gender also dichotomous. And here the socioeconomic status scale.
Can be
It's polytomous.
Polytomous, right. So yes, thank you very much. So we will be getting this combination of dichotomous and polytomous responses. But very interestingly, we have to identify which of this dichotomous response is a nominal scale and which is in the interval scale, which can yield an interval scores in the interval scale. That is the basic understanding in this case. So let me show you. This one, of course, dichotomous, this one polytomous, this one also polytomous, and here dichotomous or polytomous. So for example, gender will be dichotomous, and in information schedule, if you have other kinds of questions, in that case also it can be, the responses can be polytomous. So you have, like, for example, marital status. So someone endorses marriage. Okay, so that person will be assigned a score of 1. Someone who endorses unmarried will be given a score of 2, and so on. Okay, but the first two in this case will yield, this part is the interval scale. When these dichotomous responses I'm getting here will yield an interval scale, scores in the interval scale. And for anxiety also, this, since these are rating categories I'm getting here, these are all ordinal, in ordinal scale. But if I calculate, if I try to get a composite score, for example, there are 10 items and someone endorses, gets a score of 1 in the first item, 3 in the second item, 2 in the third item, and so on. And if I get a composite score, that will also be considered in the interval scale. But for these two scales that you can see here, these will be nominal categories mostly. Why? Because although here you will be getting dichotomous or polytomous responses, these are not leading to a composite score. You cannot simply add. Okay, so someone can endorse this particular category like unskilled worker. The person will get a score of 2. Okay, someone who endorses professional will get a particular score of maybe 6 or 7. Okay, and so on. Also, for the monthly income of the family, someone endorses the third category. He or she gets a score of 3. But this 3 is not, you cannot simply add up all these scores and get a composite score. These are simple representation of a particular category. So they are simply serving the purpose of identification or classification. Okay, so someone who is endorsing a male or female, okay, he or she is also getting a score of 1 or 2. Okay, dichotomous response. But here 1 is representing the category male. But when you compare it with this particular test item here, if someone says the answer is 4, then the person gets a score of 1, which means that the person has given a correct answer. There lies the basic difference. Is that clear to you all? So whenever you are getting some responses, your first primary purpose is to identify what does this score represent. Does it mean that the person knows there is a correct or a wrong answer? And if a person is getting a score of 1, it means that the person has that particular ability. So here I am measuring ability, and here I am simply classifying an individual based on certain attributes. That's the basic difference. Okay. So here also you can see on the left pan you can see there are certain questions like, which of the following can you often find inside a briefcase? A boss, a fax machine, a pen, a meeting. Okay, you know the correct answer. On the right pan also there are certain items, and here also you can see 4 different options. But the basic difference is that the scale on the left pan, it is a psychometric test and it will always yield dichotomous responses, and the one on the right pan is a psychometric questionnaire and it will always yield a polytomous response. Okay, although in both cases the response alternatives are similar. Okay, so psychometric test versus psychometric questionnaire, where lies the differences? So as I said, for a psychometric test, you are always going to get a dichotomous response, 1 or 0. Okay, and for a polytomous response, it will be based on the different response alternatives that you are going to have. If you have 3 categories, then it will be 3. If you have 5 categories, then it will be 5. If you have 7, then it will be 7, like that. So always it will be polytomous responses. Second one, psychometric tests, they are specific for ability testing, while psychometric questionnaires, they are specific for affect, affectivity or personality assessment. Okay. Third is the response, maximal response versus typical response. So in a psychometric test, in an ability test, we look for the best possible response, the maximal response, which is a correct response. Okay. But for a psychometric questionnaire, we look out for the typical response. What kind of response suits the person the most? Okay. There is no concept of right or wrong in case of a psychometric questionnaire. Then distractor versus response or rating category. So distractor is what, when we are considering, let me just go back to the previous slide. So for a psychometric test, here also you can see 4 different response alternatives, out of which only one is correct, the others are wrong. Okay, so these wrong alternatives are considered to be the distractors, and the purpose of a distractor is simply, as the name suggests, to distract the person. Okay, so here the response alternatives will be considered as distractors, but here the response alternatives are considered to be the different categories of response. Okay, so that's why this there is a difference in the framework of how we are trying to design a particular item in case of a test versus questionnaire. Let's see some examples. So ability testing, when we are considering a psychometric test, this is an example of a verbal test. As you can see, words are utilized in this case. This is a non-verbal test where language is used only for giving instructions or asking questions, but the item specifically will be in pictorial form. And third one is a performance test where the person is asked to perform something, to create some kind of design or solve a particular task. That is a performance test. So these are the 3 different kinds of ability tests that we have, where always there will be a concept of right or wrong answer. For questionnaires or scales, rating scale, I think you all are acquainted with rating scales, and these are mostly bipolar, and numerical rating or graphical rating can be there. You can see there is a numerical rating where numbers are assigned to particular categories, or it can also be a graphical rating. For example, this pain rating scale, you can see. Okay, sometimes when we are collecting data from children, we rely more on graphical rating scales in comparison to numerical rating, because it becomes easier for them to identify or express themselves in terms of the graphical rating scale. Self-report inventory. This is another kind of questionnaire that is very widely used for any kind of in the clinics. Generally we use. So I am easygoing. It is self-report inventory, as the name implies. I am assessing or evaluating my own behavior or thought process in this case, and the rating categories are like strongly disagree, somewhat disagree, no opinion, somewhat agree, strongly agree, like that. Also, symptom checklist, that is also done for any kind of diagnosis. Okay, symptom checklist, they use categories like low energy, not at all, sometimes, quite often, mostly, extremely. Also, there is another kind of item that you can see. I feel nauseous when at home, when at social situations, in bus or car, when at relatives' place. So can you tell me what is the basic difference between these 2 different kinds of items, both measuring, both representing the symptom checklist?
One is a Likert scale.
Okay, the other one?
No, other one is it's not a Likert scale, but the first one is definitely a Likert scale.
Okay, others agree?
Yes, the first one is an ordinal scale.
Situation.
First one is ordinal scale. Okay,
Yes.
thank you.
Yeah.
Second one.
It's a nominal type of data.
Right. Thank you very much. Thank you. That's what I needed to hear. So, although both these items are representing, both these items are, used for, diagnosis purpose, representing symptom checklist. But the first one is, as you have very correctly said, ordinal scale, rating scale. Okay, and you can see a clear, ranking, or an increasing, ascending, order sequence in the aspect low in energy, not at all, sometimes, quite often. So it is increasing, right? And as I said that for a rating scale, what we assume is that the distance between each of these categories are considered to be equal. So the distance between not at all and sometimes is equal to the distance between sometimes and quite often, and so on. So these different categories are equidistant. But the second one becomes nominal scale. Why? Because the basic aspect here is that, although here also you are given different rating categories, but here the distance between each of these categories are not equal. So when I'm saying when at home, that is one separate category. When I'm saying when at social situation, it is another different category, and the distance between when at home and when at social situation is not the same as that between in bus or car and when at relative's place. Right. So these, in this case, these are just simply for identification. Okay, where it is happening. So sometimes I can give you an example, like when children, sometimes they come with symptoms of like conversion disorder. So sometimes we ask, like, where does this happen when you are having this kind of so-called seizure? Where is it happening? Or like when you are alone somewhere, or you are with your parents, or you are with your friends. Okay, so that is the kind of item that sometimes we use for the diagnosis of conversion disorder even. Okay, so here you can see this particular study. They use this symptom checklist for depression scale. Okay, and it was developed quite recently, although the year is not given here, but it was quite recently developed and published. So yes, so now let me come to this. I can show you this particular example also. Here also you can see that the first one is a big depression inventory. Okay, and here you can see that there are these items having different response categories. For example, for the first one, I do not feel sad. So this particular item is measuring sadness. Okay, and the response categories are like, I do not feel sad, I feel sad, I am sad all the time and I can't snap out of it, I am so sad and unhappy that I can't stand it. So here also there is a gradual increase in sadness, right? But it has been broken down, and if you just simply take a look at it, it might appear that it is a nominal scale. Okay, but it is not, because when you are asking questions to a person suffering from depression, if you ask the person, strongly disagree, somewhat disagree, you might not get very relevant information from the person. Okay, the patient may not be able to relate. Okay, so that is another example of this kind of questionnaires. The other one you can see here, where you can have a clear distinction, clear rating scale. You are using strongly disagree, somewhat disagree, neither agree or disagree, and so on. Okay. Okay. Here is another example where also you can see during the past, this is the Center for Epidemiologic Studies Depression Scale, NIMH. Okay, and here also you can see how they have categorized. they have like rarely or none of the time, within bracket less than 1 day, some or a little of the time, within bracket 1 or 2 days, and so on. Okay, so these are the different kinds of response categories that they have used, and you can see that there are simply just 4 response categories they have used, not 5 or 7. Okay, and this one is, I think it is, you are acquainted with this one also. This is the Child Health Questionnaire Parent Form 50 questions, and I was just going through some of the materials which are some of the scales which are used in your domain, and I came across this one. So here also you can see there are different kind of questions, and very interestingly, I found that each of these questions, they have their own scoring pattern. For example, the first question, in general, how would you rate your child's health? I suppose the clinician asks the parent to give a rating, in a scale of 1 to 10. I don't know, maybe you will be able to help me in this. The second question is like, has your child been limited in any of the following activities due to health problem? Doing things that take a lot of energy, such as playing soccer or running. Here also it becomes nominal. Okay, and then there are questions like, how much of the time do you think your child felt like crying, felt lonely, acted nervous, bothered or upset, cheerful, like that? Okay, so this is also another kind of another example of such questionnaire. So although it might appear that this is not a very well structured questionnaire, but what I found is that this particular questionnaire, and there are other sister questionnaires like CHQ PF 28, I think. One is like 48 items, sorry, 47 items, something like that. So these questionnaires, they have their very specific precise scoring laid out for use, and it is very widely used. So the point is, questionnaires can be of different types, okay, and the response categories can also be of different types. Okay, when we are considering a test, there also the response types can be dichotomous, but the question pattern can be extremely variant. Okay, so it depends upon the intention of the test constructor, as in what you will be developing, okay, and which are the different aspects that you have to consider. For example, if you are constructing a particular test, whether it will be an individualized test, for example, like if you will be administering it to one single individual or in group. Okay, generally when we consider individualizations, when we go for performance based test, we go for individualization in comparison to, as opposed to groups. Okay, group session. Also unidimensional or multidimensional, that is another aspect that we have to consider. Then verbal or non-verbal or performance test, that also we need to decide on beforehand. And when we are trying to construct a particular rating scale or a questionnaire, the pertinent questions are whether it will be an individual or a group session, whether it will be unidimensional or multidimensional, and the number of response categories here. So what is this dimensionality of a particular construct? Unidimensionality, which means when we are measuring one single dimension only, a single construct is being considered. For example, depression. Depression is a very a single construct that is being measured by different scales of depression that we have. Okay, in contrast, when we are considering multidimensionality, it is something when the construct includes many other domains. Okay, so for example, this health related quality of life, it can include different domains like subjective response to illness, overall functioning, etc., etc. So these are the different domains that you have under one single construct, which is health related quality of life. So that is also one very important question that you have to think about before going for a test construction. Whether your construct which you have conceptualized, whether it is unidimensional or it is multidimensional. Okay. So when to use a particular measure? Individual versus group assessment. Individual assessment when test is multidimensional, because test instructions can differ for different dimensions. For example, not so for questionnaires, but if you consider a particular test, for example, you want to assess executive functions, okay, of the brain. In such a case, your test will always be multidimensional, because you will be assessing different aspects of executive functions like planning ability, like set shifting, and so on, working memory, etc., etc. So you have, it's a multidimensional construct. So in such a case, group assessment might become very difficult. Okay. Then if test instructions require demonstrations, for example, in case of performance test, sometimes we have to demonstrate first how to solve a particular task, and then only the person is able to, your subject is able to solve it. So in such cases also individual assessment is required. If the test is computerized, so of course a lot of people cannot share the same computer. So if a test is computerized, individual assessment is better, unless you have a laboratory full of computers. Okay. Subjects are children or infants, because they have their different various demands in the testing situation. Sometimes they don't understand instruction, they can ask you other different kinds of questions and so on. So in such cases, individual assessment becomes necessary. Responses are scored in terms of accuracy and latency, which is true in case of ability testing, specifically using performance test. Okay, for example, planning ability. Planning ability is measured in terms of solving mazes. Now, when you are solving maze, a particular maze, simply just solving it is not enough. What we do is we also keep a track of the time, how much time the person is requiring for solving a particular maze, right? So in such cases, individual assessment becomes necessary. Clinical assessment, of course, for a patient, it becomes very difficult if you conduct a session in group. So that is one very specific situation. And also other specific situations, like maybe a person is suffering from a very terminal disease. Okay, in such case, you cannot put him or her in a group session for any kind of assessment, that because his or her emotional emotionality might affect the responses in such a case. Group assessment when the test is unidimensional, when test instructions are simple and same for all. So in most cases for unidimensional tests, the instructions are same as in rating scales. So you give the instruction right at the beginning and your job is done. Instructions can be clearly understood by the subjects like adolescents, adults, etc. Not children, of course. Responses are scored only in terms of accuracy or rating, and subjects are homogeneous. Homogeneity means when all the subjects, they have more or less similar attributes. Okay, like they are similar in terms of their age, in terms of their socioeconomic status, in terms of their ethnicity maybe. Okay, and in most survey researches, we go for group assessments. When to use a particular measure, number of response categories. So that is also another very, very important question that you have to ask before constructing a particular test or a questionnaire. So for a test, multiple alternatives reduces guessing. I will explain how guessing can affect this particular response maybe tomorrow when we will be studying item analysis. So if the number of alternatives becomes more as it goes higher, the the chance of guessing becomes lower. A person will nevertheless guess, but the chance of getting a particular item correct only through guessing will be much lower in such a case. And reducing probability of chance response increases items reliability by eliminating the chance of guessing. As this chance of guessing is lowered, the item's reliability will also increase. So that's why for tests, it is always preferable if you can go for more alternatives, multiple alternatives. Okay. For rating scale, well, for rating scale, it's a very tricky decision that you will have to take. Okay. For example, 5-point, 7-point, 11-point rating scales are ideal when respondents are adult. But for children, 3-point or 4-point scales are more suitable since children might face difficulty in categorizing their thought process or likeness on multiple categories. Hence, they commit error of semantics. They don't understand and they just, give you random responses. So ultimately, the inter-item consistency will be lowered and the reliability of the test will be affected. 3-point categories might induce evasiveness among respondents. So if we give, 3-point like agree, neutral, disagree, it might lead to evasiveness. Okay. Also, 7-point, 9-point, or 11-point categories might result in extremeness in response. That is, respondents tend to choose the extreme points only. So as this number of categories go higher, what happens is that subjects find it quite difficult to categorize their particular thought or feeling in all these different categories. So if I give a person a rating scale with maybe 11 or 13-point categories or 9-point categories, it becomes extremely difficult to categorize a particular feeling in 13 different categories. It's almost very, very confusing. So in such cases, what happens, people tend to if they feel like it happens with me, they go on for the extreme strongly agree, and if they feel like it doesn't happen to me, so strongly disagree, nothing in between. So you get extreme responses. And why is it very important to decide on these different response categories? You will understand this tomorrow when I will be explaining the IRT models for item analysis for polytomous responses. But in a nutshell, you can say that sometimes it can happen that if you give response alternatives more than what is needed, it can happen that that particular response category can become an extra baggage for your test and it can reduce the reliability. Okay, so that's why it is very important to decide the number of response alternatives. Then neuropsychological assessment. This is specific for neuropsychological assessment, whether your test is going to be multifactorial or unitary. Multifactorial means assumption of brain localization will be there, and these are assessed through comprehensive test battery, for example, the executive functioning test battery. Okay, and unitary is assumption of functional of unity of brain as a whole, and it is assessed through psychological tests of unitary functions like intelligence. So when I'm measuring intelligence, I am just measuring intellectual functioning. Okay, I'm not keen to consider the different aspects of intellectual functioning separately. There are other tests of intelligence which consider this separately as well. Okay, but there can be both of these. So you have to decide that the test that you are going to construct, whether it is going to be a multifactorial or whether it is going to be a unitary assessment, right? So characteristics of a good test, it must be extremely objective in its approach. Reliability should be high, validity should be high, there should be norms, and it should be practicable. Practicable means it should be applicable. So it is of no use if you construct a particular test or a questionnaire and it is not applicable for data collection. Then it becomes really difficult. And sometimes you will find that there are different tests and different scales are there, which becomes quite difficult to be administered in a particular testing situation. For example, MMPI, there it is a multiphasic Minnesota multiphasic personality inventory that we use for sometimes we use for assessing personality, and if I'm not wrong, it contains 560 items most likely. So you can imagine that in a one single testing situation, you make a person sit and ask all these different questions, it becomes extremely difficult. Okay, there are other different kinds of tests or scales also, which includes this very large number of items. So in such cases, the practicability of the test or a questionnaire becomes questionable. Okay, so we will be discussing reliability, validity, norms, all these in this 5 days workshop. So these are the characteristics of a good test. Now comes items, definition, types, and construction. So definition of item. It is defined as a single task or question that usually cannot be broken down into any smaller units, also considered to be the lowest common denominator of a test. A test item is an examination of mental attributes, is a unit of measurement with a stimulus and a prescribed form for answering. So there has to be a prescribed form, a very standardized form for answering. And it is intended to yield a response from an examinee from which performance in some psychological construct can be inferred. A test item can assume any form and therefore should not be considered as a question or a statement. Okay, so in general, we find questions or a statement in a rating scale or questionnaire, but when it comes to the tests, ability tests, I've shown you it can be even a particular move in a performance test. Okay, so it can assume any form. Criteria for a good test item: it must be congruent with key objectives of your test. Writers should consider the degree to which test items may contribute to errors in measurement. The test item format should be appropriate to the goals of the test, must meet technical assumptions for test items, and should follow prescribed editorial standards and style guidelines. So these are some of the criteria for a good test item. Now let's see what can be the basic or general outline for a questionnaire or scale item. First of all, wording should be objective. Items should be measuring only the construct in question and not anything additional. If that happens, then it puts a question mark to the validity of the test. Okay, the precision becomes impaired in this case. Number of response categories should be judiciously decided, as I've already explained. Should be discriminating enough. Okay, that I'll be explaining in a short while. And scoring should be objective as much as possible. So for a verbal test, no ambiguity in wording should be there. Direct hint should be avoided. Statements should be short, simple, and straightforward. You can see some examples are given here. High correlation with external criterion fails to establish convergent validity, concurrent validity, discriminant validity, differential validity. Okay, or adoption weakens the moral fiber of our society. Okay, so this is called the item stem here. Okay, and these must be very, very short, simple, and straightforward. Non-functional words should be avoided. Okay, so for example, I should not be like the high correlation with external criterion. In this case, the word the becomes non-functional. Then phonological similarity and clang associations should be avoided. It's like, I know, high correlation with external criterion or high correlation with external criterion fails to establish the validity of, then convergent validity, concurrent validity, like that. So in that case, it becomes an example of phonological similarity and clang association. So that should be avoided because that becomes a direct hint. Interlocking items must be avoided. So you might be finding interlocking items in competitive exams questions. So they give a situation and then give 2 or 3 questions related to the same situation. But when you are designing a particular test or a questionnaire, these interlocking items must be avoided, okay, because it affects the reliability and validity of the test as a whole. Response categories for rating scales should be reasonably chosen. For non-verbal test, figures of same dimension should be similar looking. So you can see here, this is another example from the Raven's progressive matrices, which assesses intelligence, fluid intelligence, and you can see these are the response categories. These are exactly similar looking, shape and everything, just the inner content is different, and based on this inner content you have to judge which is the correct answer. So figures should be objective and should be conveying only the relevant information. If response alternatives are also in form of figures or symbols, then all alternatives should be of similar format, as you can see in this case. Distractors must also be similar to the correct alternative. Okay, so here among these 8 different alternatives, only 1 is correct. The other 7 are the distractors, but they are similar looking. Okay, position of the correct alternative should be varied for each item. Okay, for every alternate, all the items you have, and even for multidimensional tests, care should be taken to keep the item formats similar for each of the dimensions. Okay. For performance test, instruction should be absolutely simple and to the point. Respondents must not face any difficulty or ambiguity in understanding the test process. So in a performance test, the instruction becomes very, very important. Okay. Response format should be kept simple as much as possible. Okay. Respondent should be completely informed regarding the possible sources of error. Okay. What can be the errors that can happen in a particular testing situation? You have to inform it beforehand. Multiple practice trials must be given prior to commencing the test. Okay. Rest can be given in between trials for eradicating fatigue, since it is a performance test, and also feedback might be provided in appropriate cases. Fourth type of testing is, these days it is becoming more and more popular, computerized test. Okay, where instruction should be absolutely simple and to the point. Respondents might not face any difficulty or ambiguity in understanding the testing process. Response format should be kept simple as much as possible, almost similar to what we have seen in case of performance tests. But computerized tests are different from computer adaptive testing. These two are different things. Okay. Computerized test is when you are administering one particular test or a questionnaire through in a virtual form, in a virtual platform. And computer adaptive testing is what you have, I think, for NEET examination, they are using the computer adaptive testing. So computer adaptive testing is completely based on IRT process, IRT approach, item response theory approach. And there it is like, if you are able to answer one particular question correctly, based on your score in that particular question, the next question will come up. Okay, if you make an error, the next questions that will be coming up will be of lower difficulty index. So it is like the system is constantly adapting to your ability. Okay, that is the computer adaptive testing. Okay. So another set of questions for you. So these are, you can see there are 4 different questions. You have to tell me which of these questions are problematic. So let's consider the first one. While dealing with a problem, I mostly prefer to make compromises. Mostly true, somewhat true, a little true, not true. What is the problem in this particular item? Can you tell me, anyone?
The word true is coming.
Mostly, the word mostly is coming both in the
Yes,
question
yes,
and
yes.
the stem and the item.
Right. So here, as I am using mostly in the item stem, it becomes a direct hint. and it leads the person to a particular direction. So it's a leading question I'm asking. Okay, so that's why it is a wrong one. Second one, tell me, I feel tense and sad. The options are not at all, sometimes, often, mostly, always.
Hello, this is wrong because it's the double-barreled question. It is asking two questions at the same time.
Right. Thank you very much. So, tensed and sad both at the same time. Okay. So, it is definitely not the lowest common denominator here. Okay. So, here also it is wrong. The third one, my parents do not pay attention to my schoolwork. Not true, slightly true, sometimes true, often true, mostly true. What is the problem?
There is a double negative, not in the question and not in the answer.
Can you please explain it, sir, a little bit more?
It is a double negative statement. Question has a not and the answer also has a not.
Okay, that's a very good answer. Any other answers? Anything else?
The scale is not balanced. It's like the neutral point is missing.
Okay, any
The
other answer?
scale is inverted. The not true is first instead of the mostly true.
Okay. Okay, so many things are coming up. Any other answer?
The parents is only the instant other. So child, maybe your mother is paying attention and father is not paying attention. It's difficult for
Try to
child to
focus
answer.
on the response alternatives that you have here.
Okay. Yeah.
Often true and mostly true carry same meaning, I think.
Yes, often true, mostly true. Sometimes we use this category. So there does not lie the problem, but the problem lies in
Slightly true and sometimes
yes,
true.
right. Thank you very much, sir. So the problem lies between these two alternatives, slightly true and sometimes true. Okay, so when I'm saying sometimes true, often true, mostly true, it is like I'm talking about it's the when it is true. Okay, and when I'm saying not true, slightly true, it is like how much it is true. So there is a very basic difference, and in this case, this slightly true option becomes redundant. So if you administer this particular item, you will see that children will get confused between this slightly true and sometimes true, because both of these are more or less giving the same hint. So that's why it becomes a problematic item. Okay. And the fourth one, what is the problem? Yes.
It's very interlocking, I think. Like many answers may be possible.
Yes, thank you very much. So here, one can say potato because potato is not a fruit. Someone can say banana because it is the shape differs. Okay, so there can be multiple answers, and it loses its precision. So that's why it is also a problematic item. Okay. So these are some of the next we will be discussing some of the questions, frequently asked questions for item construction. First is how to decide whether the item is suitable for the target respondent or not. Okay, so we do not know when we are writing a particular item, whether it is a test or a scale questionnaire, whatever it is. When we are writing a particular test or a items for a test or a questionnaire, we do not know whether this particular item is suitable for the target respondent or not unless we conduct pilot studies and do item analysis. Okay, so the answer to this question is, after writing your items, of course, there are some preliminary steps which you can follow, like you can go for a content validity index, calculating the content validity index, and get the opinions of different judges. and then you have to go for a pilot study, because this pilot study will tell you which particular item is suitable for a target group. For example, when in my work, in my experience, I found that certain items, when I was developing, I was working with children as young as 7 years old. Their cognitive aspect, I was trying to assess spatial reasoning, and I found that I was little confused about whether the kind of items that I have designed, whether it will suit their age or not. But when I went out and collected data, and I found that they have this kind of intellectual functioning, they could solve the items. So you never know unless you go for pilot studies. What should be the ideal difficulty level of the items of a test? Okay, whether it will be too difficult or too easy. Now it depends upon your intention. Okay, so in general, we put items of increasing difficulty level when we are doing an ability testing. So for any ability test like intelligence, aptitude, reasoning, etc., etc., you will find that items are placed in increasing order. Okay, increasing order of the difficulty level. But sometimes it becomes important that you have to consider other aspects as well. The second thing I have mentioned, like midway between chance and maxima. So this is something that, of course, I will be explaining this tomorrow when I will be discussing item difficulty level in details. So sometimes it happens that you have to consider the guessing parameter as well. So whether the child is getting a particular item correct just by chance, or the person has got the ability that is required to solve that particular item, I do not know. So sometimes in such cases, we have to decide on the difficulty index based on after considering the chance score that can be obtained for that particular item. Okay, and also we have to decide whether it will include both easy and difficult items. For example, if you are considering a particular test for children who are in their developmental period, you have to include both easy and difficult items. Okay, otherwise it becomes erroneous if you put two difficult items or two easy items. Okay, also for adult population also we have to put both easy and difficult items, because otherwise it won't give us a very clear indication of a good measurement of the distribution of a particular trait in the population, which is assumed to be normal. For example, intelligence, the distribution of intelligence in the population is assumed to be normal. Okay, so there are people who are of higher intellectual functioning, and those who are having lower or less intellectual functioning, people who are mentally retarded, okay, and people who are genius. Okay, so unless and until we include items which can assess both these two extreme categories, the test will give us only a very limited information. As you can see in this particular graph, this particular curve, it is showing us that if this is the ability level, it is this particular test is a test information function. I'll explain this tomorrow. But you can see that the maximum information is in the y-axis. So maximum information is obtained at the lower level of this continuum, ability continuum. Okay, so the test is of course not a very good measure in this case. Okay, and sometimes if you're you are trying to design a test or a test for a screening purpose or a questionnaire for diagnosis, it becomes very important that you consider the consider the difficulty level of the items very judiciously. Okay, so how many items should be constructed? So construct large number of items, because item analysis will lead to a lot of modification, deletion of items, and the target test length or the questionnaire length should be concise. It should not be extremely large or it should not be too small, but concise, because it affects the test or the questionnaire length affects the reliability and validity of the test as a whole. That's why it should be concise, but at the very outset, it is advisable that you write at least 5 times the target test or scale length. Okay, so if you want to have the final questionnaire to have 30 items, you should be writing at least 150 items at the very outset, and then go on cancelling the items and choosing the best ones. Okay. How many alternative responses should be given? This I've already explained. Reasonable number of response categories for questionnaires and for tests, as much as possible. Okay, and these are some of the steps. So where to start before even going for writing the items? These are the different steps that you can follow for getting an insight regarding how to write good items for your particular construct you want to measure. So the first one is already existing measure. So if there is an already existing measure, for example, you can see here this 3D cubes were designed by Shepard and Metzler in 1971, who did groundbreaking research in the area of visual imagery. So these cubes, although they look very weird, these are extremely objectively designed. All these different cubes, they constitute 10 different squares of equal size and shape. Okay, just rotated to different axes. Okay, and these are present right from 1971, after they have designed these cubes, and there is a huge library of these different shapes, and all throughout this last 50 years, these cubes have been used over and over again in different measures of mental rotation. Okay, so if there is an already existing measure, you can try to you can adapt some items from that particular measure, and then of course you have to standardize it for your own population. Okay, so that can be one way out. The second one is focus group discussion. So for example, you want to assess how people are coping with the COVID-19 crisis, right? So since it is a very new thing, new normal, we do not know what is going on. So people who are you must be knowing, you are dealing with COVID patients on a daily basis. So probably if I want to construct a particular test or a scale for this particular for measuring this particular attribute, I would like to have a focus group discussion with you all. Okay, so focus group discussions can be it can include groups where groups must be very small in size, and the duration can be like 60 to 90 minutes. There can be multiple sessions, and in such cases the participants should be related to the conceptualized construct. So if in this case for the COVID-19 coping with the COVID-19 crisis, since you are in direct contact with patients who are suffering from COVID-19, who have developed symptoms, I might get lot of good input from your end. Okay, so focus group discussion, they help us to generate ideas. Okay, ideas about how we can write good items. Okay, discussion with experts. So it is also known as the standing on the shoulder of the giants. So experts who are working in this field, they can be consulted. Okay, and multiple experts can also be considered, and they can provide you with a lot of inputs based on their experience. And you can see this this is a particular inventory of depression, the Tate depression inventory, and it was in this particular while constructing this particular inventory, the researchers, they followed this same method. They discussed they consulted certain experts in the field, and based on their inputs they constructed items. Okay. Existing theories. So if there is already an existing theory, you can go on developing your test or questionnaire based on the theoretical assumptions that you have there. Okay, for example, here you can see Holland. He talked about he gave a theory of interest. Okay, how interest develops and how it affects the different professions, how it can lead to different professions, and we call it the RIASEC model, which is the realistic, investigative, artistic, social, enterprising, and conventional. And he talked about like how if people they are realistic, what are the different professions. For example, if a person is realistic, the person can go for public health, okay, veterinarian, public health, dentist, and so on. If a person is investigative, the person can go for go on becoming an epidemiologist, environmental health specialist, health services researcher. If the person is artistic, maybe public health communication specialist, and so on. So based on this particular theory, this particular model, he developed this interest inventory. Okay, and it consists of, I think, 32 items as a whole. And if you solve this particular, if you give your responses in this particular inventory, based on your score, it can be predicted that which will be more suitable for your personality, and you can take it as a career guidance in that case. Okay. Another example, like this vendor gestalt test. I don't know how many of you are acquainted with this particular test, but BGT is a very, very widely used test for also for even for neuropsychological assessment. And here BGT, in this case, you will find there are certain images you can see here. These images, what we do is that we show these images to the patient and we ask them to replicate it without seeing. So they take a look at the different figures, then keep the card aside, and then try to reproduce the structure that was there. And based on their responses, lot of conclusions can be drawn about if there is any kind of prefrontal, any kind of deformity or any kind of problem is there in the prefrontal area of the brain, or there are some kind of emotional problems that the person is facing. Lot of things can be inferred. So this particular test also was developed based on the Gestalt theory of structuralized configurations. So Gestalt's theory talked about this, perceptions that we have, that our brain receive, visual perceptions, and it says that when we see something that is a visual motor pattern which reveals modifications in the original pattern by the integrating mechanism of the individual who has experienced it, the whole is more than the sum of the parts. That is the basic idea. And based on that particular theory, Laura Bender, she developed this particular test, okay, now which is now widely used for any kind of assessment. And finally, the researcher's insight. So that is, in most cases we rely on this particular kind of this particular step. So researcher's insight includes if you are trying to conceptualize a particular construct, you simply think of items on your own, not relying on anything else. You do literature review, you go through the different real phenomena that goes on around you, and you go on constructing or writing your own items. So that also you can find in this particular paper. They have developed this behavioral activation for depression scale, was published in 2006, and here the researchers, they use this similar method to write their items. Okay, so these are some of the very basic steps which you can follow, which can give you a lot of inputs about how to write your items. So once your items are written, these are some of the steps that you can follow to construct your test. So conceptualizing items, which I have already discussed, Item writing, also another thing that we discussed so far in our today's class, and preliminary administration, which involves going out with your, as I said, you go on, administering the tests to the different, your population, to check the suitability of the test items which you have written. Okay, do item analysis, which is the next step here, then estimating reliability, estimating validity, and lastly, preparing norms. Okay, so far whatever we have discussed, so the summary can be summarized like: defining a clean construct requires precision and objectivity. Psychometry deals with assessment, measurement, and testing. There are two types of psychometric tool, like ability tests and affective questionnaires or scales. Responses can be divided into dichotomous and polytomous types. A good test must have the properties of objectivity, reliability, validity, norm, and practicability. An item is the smallest element of the test and it requires a lot of precision. Finally, test construction is an extremely detailed process that requires statistical validation. Okay, so I'll stop here today, and I think a lot of things I have discussed today, so I can take questions if you have any question.
Hello, ma'am. Can you hear me?
Yes, please
Yeah.
go on.
Madam, in the X depression scale, in the very initial part of the presentation,
Right.
You had mentioned like, do you feel depressed? There was one question which was related to assessing of depression amongst the patients. So we said that it is an interval scale, correct?
Sorry, I didn't get you.
We labeled it as an interval scale.
Yes.
Yeah.
For all practical purposes, I have found that BDI2. This is the item that we talked about from BDI2, and I have found that BDI2, while the standardization it was done, they used IRT models which are very specific for rating scales. Okay, like they use the graded response model for standardizing the BDI2. Okay, so in that way you can consider it. Of course, it is a interval. It is an sorry, not interval. It's a rating scale, but you take the composite, and the composite gives you. The composite can be considered as being in the interval scale.
So the interval between any two responses is like from no to somewhat. The interval between these two, and from somewhat to mostly, the interval will be same. Like this cannot be quantified.
This cannot be quantified. Very good question, sir. And I will be discussing a little of this in the rest of these days also. So that is one very important, what should I say, like a limitation of this particular scale. For example, if, as you very rightly pointed out, that the distance between sadness, not at all, and I feel sometimes sad, and the distance between I am so sad that I am always crying, and I'm so sad that I cannot stand it altogether. So the distance, it is assumed to be similar, right?
Assumed.
But yes, it is assumed to be similar, but it does not mean that it is there is a very true similarity. I can even share with, I think the paper I have already shared with you in the workshop resources. You will find there is a folder called studies_scale, and there you will find lot of different scales, a lot of different papers I have given for your reference. And there is one particular paper which very specifically criticized the structure of this particular scale. And another thing that I would like to mention here is that this is another complication, which of course I will discuss tomorrow again, that when I'm considering a person who is having, say for example, who has obtained a score of maybe 38 in BDI 2, okay, and also there is another person, a second person, who has also obtained a similar score. So both of them, they have obtained a score of 38. Okay, does that mean that both these persons, they have similar symptoms of depression? Well, the answer is no. The BDI2 structure is, it is designed in such a manner that if you get it correct, you endorse certain symptoms, and you get a composite score based on all the different endorsements, and it gives you a measure of the severity of the depression. Okay, but the problem is, when I am saying that a person has obtained a score of 38, okay, another person is also has obtained a score of 38, both of them, they have high depression. Does that mean that the symptoms are same in both the cases? It is not. Okay, so that is one very specific criticism of BDI2, and that's why you will be finding that lots of scales of depressions are coming up these days. In the last few years, many different scales of depression have been developed. Okay, does that answer your question, sir?
Yes, yes. Thank you so much.
Yeah.
Okay, we have to wind up the discussion within 9 more minutes. So please
Okay.
ask your questions fast.
Okay.
Anybody else wants to ask anything else?
Okay, there are some questions in the chat box. Okay, I'm trying to get to them.
Yeah, I have noted it down, Dr. Ibu. Can I just summarize it quickly?
Exactly. You can do that.
Okay, madam, the questions which were asked were already answered. Beg depression, whether the intervals are equal. One person has asked, how is occupation polytomous? One can only do one job at a time. So she has asked that how is it that it is polytomous? So because
Occupation.
yeah, you can only do one job at a time. So
Yes.
how is occupation polytomous?
No. Yeah. Okay. Let me just answer this particular. Okay.
And the third question, madam. The third question is, somebody has asked whether any overall score, if there is a composite or overall score, whether weighting is required, and if so, how is it determined?
Okay. Fine. So I'll answer the question for the occupation thing. If someone endorses a particular category of occupation, okay, it is polytomous in the sense that here also we have 5 or 6 or 7 different categories. Okay, so polytomous means that when you will be getting the data in your Excel sheet or SPSS sheet, you will find that there is a mixture of 1, 2, 3, 4, 5 different categories. Okay, but the most important difference in this case is that this 1, 2, 3, 4, 5 categories that you are getting, these are all just for identification of a particular category. Okay, but when you are considering a particular test item, a scale item, okay, there 1, 2, 3, 4, 5, those are all response alternatives which indicates some amount of your favorableness or unfavorableness and so on. So there lies the basic difference. In the second situation, the polytomous responses that you will be getting 1, 2, 3, 4, 5, those are in ordinal scale. But in the first situation, in occupation, you have very rightly said that one can do only one occupation at a time. But when you are tabulizing it, okay, and you have to assign certain numbers, otherwise you won't be able to utilize that particular variable for statistical analysis. So in that case, you have to assign some numbers, and these numbers are simply for identification, nothing more than that. Okay. I hope that answers your question, madam.
Okay, can I add something to that, madam?
Yes, sure, sir.
Okay, the thing is that another thing is that you have to take into account what are the possible responses, not the response a particular individual is giving, but the number of possible responses. So in an occupation, one can give 5 or 6 responses, and that will determine whether it is dichotomous or polydichotomous. Okay, but if the possible responses are 2, it will be dicho. If it is more than 2, it will be poly. So not the individual person, because sex is again one can give only male or female. So what are the possible number of answers that will determine? Thank you.
Right. Thank you very much, sir. Thank you. Okay.
Can I ask you something?
Yes. Please go on.
Very quickly.
Okay. Hello. Yes. can we quantify the Likert scale? I mean, if the question is, suppose how frequently do you watch movie? So instead of mentioning always, mostly, can we quantify it in terms of always means 3 to 4 times a week, mostly means thrice a week, to make it more specific, so that the participants, they are very clear about it. Can we quantify it?
Of course, absolutely, you can do that. No problem in that. And it is very much desirable that you do that. Okay, otherwise it becomes difficult for them to understand sometimes.
Thank you.
Yeah.
Okay, thank you. And ma'am, what type of Likert scale is better? The 5 point, 7 point, 9 point? Because you said that 7 or more than that, it will bring extreme values. I mean, the participants, they tend to mark the extreme values. So is it that the 5-point scale is better?
Yes, in that way, 5-point scale is better, but also sometimes you will find that even the 5-point rating scale response alternatives, also there can be certain kind of problem, like the response alternatives can become redundant in some cases. I will demonstrate this part tomorrow in tomorrow's session, how sometimes it becomes redundant, and in such a case you have to go for maybe 4 alternatives. Okay.
Okay, which is the best scale? I mean, I want to know that which is the
It
best.
depends on your first of all your research intention. Secondly, your population on whom you are from whom you are collecting data. Third, the kind of responses that you are obtaining. Okay, sometimes it happens that you think that it is absolutely fine. You go on administering the test or scale, and then you find that the categories, one of them has not been endorsed at all. Okay, that can also happen. So there are several things that you have to consider in this case.
Okay, thank you, ma'am.
Okay.
Thank you.
So I think we can wind up for today, Dr. Rivu.
Yes, we can wind up. We can continue discussing in the chat box also. So thank you. And any more comments, Kaushikda?
We can wind up for the day, but we can continue discussing the WhatsApp group as well.
One feedback, as ma'am said in one feedback just.
Abhishek da?
Abhishek da, I think, has got disconnected.
Okay, fine. So we can end today, and tomorrow we shall be again meeting at 7 o'clock. But you need to have your Art Studio and installed and load the dataset file and the script files also, so that it can be very smooth experience. And if any questions are required, you can also ask in the WhatsApp group. Shimona madam, if you can, many other participants were asking whether you can share the PPT. Okay.
Yeah, of course, I will be sharing it.
Sharing. Thanks, madam.
Thank you, ma'am.
Thank you.
Tomorrow also session will be for 2 hours. Sorry to interrupt.
Yes, 2 hours, I think, but it will be better if we can have a little longer session tomorrow.
No problem. We just asked to make it. Came 2.5 also.
Okay. Because tomorrow I have to cover a lot of things, so that's why.
Okay. I think the participants shall try to get the most out of this experienced faculty. So maybe there shall be some spillovers. Please arrange accordingly. Okay. So target your dinner or some other activities at 9:30. That will be, I think, a good margin. Right, Dr. Shimona?
Yes, of course. Not a problem. I'll try to finish it as soon as possible, but for your convenience, because tomorrow I will be demonstrating things in Art Studio, which is I believe new to a lot of you. That's why I was saying this.
Okay. Thanks a lot, madam. Okay. Any more queries? Any more questions?
If there are any more queries, you can put up in the WhatsApp group as well.
Okay. Right.
Yes.
So we are signing off today. Then thank you. Okay. We can disconnect now. Okay.
Thank you.